Hello and a very good afternoon to all of those joining me live on the Facebook page of News 9. I'm Neha. Now, coronavirus pandemic has changed the way we used to live and certainly the way we celebrate festivals. Talking about that, Diwali is just round the corner and the Rajasthan government has decided to ban the sale of firecrackers due to COVID-19 pandemic. And this is certainly the time to ask if other states should follow suit. Just a few days ago, if you remember, Jharkhand chapter of the Indian Medical Association issued a warning to the respective state government asking them to either stop the sale of crackers or be ready for a COVID disaster. Senior doctor Dr. Pradeep Bhattacharya, while talking about it in detail, said that Diwali is on 14th of November this year. By that time, winter would set in and the dry air could aggravate breathing difficulties, especially among those suffering from lung ailments. If we add smoke to the ambient air by bursting crackers, then it could turn out to be a recipe for disaster. Pollutants released from the crackers, of course, will remain suspended in cool air for a longer duration. This is what he spoke, in fact, while giving an interview to a leading daily. Now, to understand more about the adverse effects of bursting firecrackers during Diwali amidst a pandemic, joining me live is Dr. Sitesh Roy. Many thanks, Dr. Roy, first of all, for taking out some time and speaking to us. Sir, break down the correlation between smoke and COVID-19 and why is it so important for us to celebrate a cracker-free Diwali, especially this year?
Yes, Neha, this is a topic of prime importance because we are moving into the months of the year where we expect air pollution anyways to increase because, as you said, cold weather setting in, cold air moves less, travels less, tends to be more dense and settled. So an area with smog or fog tends to be more in that way. And it has been already associated around the world that up to 15% of the COVID-19 deaths have been due to pollution. So in higher polluted areas, the people who even go into the ICU or die from COVID-19 is higher. Now, when we look at the different components of smoke or of pollution, we have something called particulate matter, and then we have something called gaseous pollutants. And both the particle matter 2.5 microns, which is the smaller size of air particles, which have pollutants, and also nitrogen dioxide and nitrogen oxides have been associated with increased COVID deaths or COVID fatalities. Recognizing this, we know that as Unlock 5.0 has progressed, we now have more vehicles, we have more industries, and both of these, through the burning of fossil fuel, oil, gas, petrol, are producing more and more of PM 2.5 and nitrogen oxides. If to that we add the firecrackers, which we know in the past, just in the area like Delhi, have shot the PM 2.5 levels above 600, where the normal AQI should be less than 100 or 50. So we can realize that there can be immense impact of both the combination of cold weather with air pollutants on both the incidence of COVID-19 as well as the severity of COVID-19. And so this becomes a prime reason why all the states should truly reconsider about the effect of firecrackers and the time of Diwali on
Dr. Roy,
not just patients with lung disease.
Right. Dr. Roy, does the smoke which emanates from firecrackers, pose a danger, significant danger to people of particular age group, or does it impact everyone equally?
So it has generally been found that children below the age of 5 who tend to have smaller lungs and smaller air tubes, and adults who are above the age of 60, which we also know is a risk factor group for COVID-19 and SARS-CoV-2, are most affected. And next in line would be the people who have lung diseases like asthma, COPD, interstitial lung disease and other chronic lung diseases. So these would be the people who would be most severely affected. But as we know, air pollution by itself has been associated with cardiovascular deaths, with stroke, with cancer, besides lung diseases.
So
I think
doctor,
the
in this
impact is
case,
really
what about
universal.
those who have recovered from the pandemic?
Certainly, Neha, it can have a huge impact on people who had what would be called a COVID pneumonia, because even a person with an asymptomatic COVID-19 infection can have changes detected on a high resolution CT scan of their chest, where they may have what looks like a lung fibrosis but actually is micro blood clots. And such people, if exposed to Diwali smoke, firecracker smoke, and all the other stuff that happens with it, could certainly have breathing difficulties, cough, breathlessness, chest tightness, and other symptoms, which can be very concerning and can end them up back in the hospital or even worse.
All right, all right. Dr. Sitesh, now that we have already spoken about, of course, this, so what are the preventive measures that one should take during Diwali? And, for example, I may not be bursting crackers, but someone in my vicinity might. So what are the steps that I can take for my well-being?
Certainly, I think very important question. So the first thing is for people who are at high risk, like the ones I just mentioned with lung diseases or other problems, these people should stay indoors as much as possible. Once in a while, they may be able to move away from a very busy city like Mumbai, where there may be a lot of problems, or Delhi, and go into their rural homes or into their villages where likely the air is more freely moving around and there are less firecrackers being burst. And lastly, if someone does develop symptoms, they should not delay seeking medical care. Certainly, people, if they light more diyas, which produce less pollutants than probably a firecracker would, and would resort to more traditional ways of celebrating this wonderful festival of Diwali, I think they can keep themselves, their neighbors, and their society safe. That's really what I believe.
Right. Thank you very much, Dr. Sitesh, for joining us with all of those important insights. Well, we understand that Diwali in particular is very close to our hearts, but as they say, festivals will keep on coming and going, but health won't. So take care of yourself, stay safe. Many thanks for watching. If at all you like this video, do not forget to subscribe News9 YouTube, like us on News9 Instagram, Facebook, as well as Twitter. Stay safe, keep those masks on.